Now, for the next father of orthopedic, we should be looking at his biography is what Dr. Marc Swiontkowski. It looks like a Russian name or a Czech Republic. Russian name, Czech Republic. Um, this country that is fighting with Russia. No, it's not Romania. This country that is fighting with Russia, they're actually brothers. Do you understand? They split along the line, though. Ukraine. All right, they have this kind of names. All right, so that's what we got. Then we're talking about this man. All right, so this is the gentleman, and let's talk about his biography. So Dr. Mark Swiontkowski is an international world recognized orthopedic surgeon. Okay, he specialized in trauma surgery, and I think lucky enough for him, he has not died. I think for about 100 fathers of orthopedics I've spoken about, most of them have died. He's still alive. So he's a professor of orthopedic surgery right now. Okay, no, before at the University of Minnesota. Okay, no, right now. Okay, he was the former chair of the department from 1997 to 2007. So right now he's just a professor, just a big man living his legendary life. So he was also a past president of both Orthopedic Trauma Association and the American Orthopedic Association. His career has focused on advancing fracture care, non-union and malunion treatment. Okay, so his medical degree, he graduated from the University of South California School of Medicine. That was in 1979. He did his residency at the Orthopedic Surgery Hospital. That's the University of Washington, Seattle. Fellowship, he did his fellowship at Orthopedic Research Laboratory for Experimental Surgeries at Switzerland. Okay, the good guy. So what's his career highlight? He at University of Minnesota, he's a professor of orthopedic surgery right now. He was the former department chairman from 1997 to 2007. That was what? 10 years, right? 10. Okay. So he's also an adjunct professor at the School of Public Health. I feel like every doctor should do public health. I just feel like it's a master's degree, 2 years. I feel like every doctor must do public health, guy. So his clinical focus, he's focused on trauma surgeries, he's focused on fractures, he's focused on non-unions of fractures, he's focused on malunions of fractures. Fracture does not, that's two bones, there's a break in continuity. So they did not fuse. There's non-union. Okay? Two bones are supposed to fuse straight, but they fuse to the side. Okay? There's a malunion. Okay, that's basically his focus, right? Also in pediatric fractures. So he treats children. He should definitely have a good heart. Only good people treat children. Okay? He's also focused on osteomyelitis, that's inflammatory conditions of the bone due to infections, and also leg length discrepancies, or you can see leg length inequality. Your right leg is longer than your left leg. Your left leg is longer than your right leg. Crazy things, you know. So leadership roles, he's the past president of Orthopedic Trauma Association. He's the past president of American Orthopedic Association. He currently is an editor-in-chief of the Journal of Bone and Joint Surgeries. Okay, they publish online. So if you have any, if you are doing any successful case, you report online. If you see any rare case, you report online. All those kind of things. So he heads there. So okay, so I think this is what we got for this good doctor. He has done a lot of work on fracture healing and biomechanics and surgical techniques. Okay, he has done a lot of research on tibial fractures, internal fixation methods, femoral neck fractures, open fractures, and of course their management or